What's good with it, veterans, military? Hey, today we're going to be talking about VA disability claims process and how to best tackle that PTSD C&P exam whenever you do get called in. Build that strong foundation prior to submitting that claim. Let's get into it. So, first of all, we got the DBQ. You can find this on the VA's website, va.gov. You know where it's at. I gotta beat a dead horse. And this is specific DBQ for PTSD. Outside of all the boring stuff, let's go into section 1, Diagnostic Summary. First question: does the veteran have or has ever been diagnosed with PTSD? It has to be a yes in order to get service connected. Yeah, the VA says, some VA raters, some claim specialists, they say, hey, you don't need a diagnosis of PTSD prior to putting in your claim. However, 80% of veterans getting denied for VA claims specifically for PTSD are denied due to a lack of a diagnosis. So with that being said, definitely, whether it's 5 years, 5 months, if you're seeing a doctor, psychiatrist, therapist for PTSD, make sure before taking any medication or that you go any further, have that professional evaluate you for PTSD and render and give you a formal diagnosis. Moving on. Okay. Current diagnosis. If you have any other mental health disorders such as insomnia, depression, anxiety, aggressive mood disorder, you like sucking on toes, whatever, IBS goblins, whatever the case may be, this is where that C&P examiner is going to take note after reviewing your medical evidence. Now, one of the main areas in which a lot of veterans get mistaken in order to get service connected as well as get an increase to their already service connected VA PTSD, they think that, okay, if I have multiple mental health diagnoses, it's going to help me get an increase. No, that's absolutely not the case, and that's actually incorrect. In order to get an increase to PTSD or any other mental health VA rating, you got to understand, okay, the VA is looking for severity of symptoms, a combination of symptoms, as well as impact mild to severe to your personal and to your occupational work life. Moving along. Okay. Does the veteran have one or more mental health disorders? It can be a yes or a no outside of PTSD. As well as, can those symptoms be differentiated from each other? Does the veteran have a diagnosed TBI, traumatic brain injury? Yes. If you do, okay, cool. But can that medical evidence be differentiated? Now, for migraines and TBI specifically, if you have a service connection for PTSD, in order to get separate ratings for those, your symptoms need to be differentiated from, because migraines as well as TBI are symptoms of PTSD. So keep that in mind. You understand me? Going on into the occupational and social impairment. This is going to be the bread and butter on after you've established, yes, you have a diagnosis for PTSD. Yes, your stressor has been identified, which we will talk about at the end of this specific DBQ. Occupational and social impairment. Pretty much starting at the low end, you got a diagnosis. Okay, cool. You got some signs and symptoms that are starting to affect your personal and your work life, but it's not serious. Then it starts to move on. It goes from top to bottom being the most severe. Now, if your PTSD is so severe that it's causing you to not even have work, you're getting out of work, you're being fired from work, you can't hold down a job, you're having issues in and out and around your family, spouse, kids don't like you anymore, your brothers, sisters don't like you anymore, your parents, family members, stuff like that, that's total, okay, cool. As well as when it comes to work, coworkers are not tolerating you. Supervisors don't even want you in the building or in the same work environment. It's toxic. Not toxic, but it's a hostile work environment for you being there. So, hey, that's, 100% check, along with some of the symptoms that you need to be experiencing. Clinical findings in this area, criterion A through motherfucking G. This is where that C&P examiner is going to identify your stressor. Now, it's not really known to a lot of veterans, but it's not really known, but whenever you put in a claim for a PTSD, you're going to need a diagnosis and your stressor identified. Now, whenever you're talking to the C&P examiner, if you got a diagnosis, cool, they're going to diagnose you. Okay, cool. That's a check in the box. But when it comes to your stressor, series of events pertaining to just you and that event, and your diagnosis of PTSD, everything that you're dealing with, you want to make sure that that CMP examiner understands and clearly I can identify your stressor from the medical evidence in which you supply to them. So I do suggest, if you're working with a VA medical provider, have them write down everything. Or if they're not writing it down, follow it up with a secured message, blah, blah, blah. So it's in the record. So it's on record. If you're going the private route, it's a little bit easier to get this medical evidence, because in the private sector, therapists, psychiatrists, they're a lot better with recording information, putting it into your medical record with them specifically. So you can always reach back, obtain a copy, and add that to your VA claims file. Moving on from there. Symptoms associated. Now, it's not a specific amount of symptoms that needs to be associated. But however, whenever you get your decision letter, if you're missing some things, that 8% VA disability rating for PTSD. And they tell you like, hey, you could have warranted a 70% VA rating. However, these are some of the things that they look for when adjudicating claims and processing veterans for a 70% rating. Or if you have 70%, they'll be like, okay, hey, we're giving you 70%, but you don't rate 100% for PTSD due to these factors. Well, because this is what we're looking for. That's in a nutshell. You want to make sure that your medical evidence serves or shows these symptoms in your record, outside of anything that you still want to report. But at least when it comes to the DBQ and what the VA is actually looking for as terms of symptomology, you want to have some of these things in here. Depressive mood, anxiety, suspiciousness, panic attacks, chronic sleep impairment, flattening effect, speech impediment. Some of these things on here. So, as well as they're going to be measuring your behavioral observation. Are you reserved? Are you shy? Competency, results, and that's about it. But hey, y'all like this type of content, y'all know what the fuck to do. Hit that motherfucker like, subscribe, share. You got any comments pertaining to your own specific VA PTSD claim, let your boy know down in the comments. You got any questions on how to get service connected, or where you're at currently in the process. If you were denied, let your boy know. Let's get you service connected, as well as if you're trying to seek an increase. Hey, till next time, y'all know what time it is. Motherfucker Debo out. Motherfucker 2023 year to vet. Stay fucking Gucci with it.